Action.
Alright, so we just did your vital signs. I'm going to go ahead and just do a head-to-toe assessment on you. So throughout the exam, when I'm looking at your skin, we're noting the color, if you have any edema, any moisture, your skin trigger, any abnormalities or lesions, making sure it's nice and warm, appropriate even tone. So first we're going to go ahead and start with your head. So I'm just going to palpate your head. You let me know if you feel any sensitive areas or anything hurts. We're going to look at each side of your neck, your back. Palpate your frontal sinuses, your maxillary sinuses, and then the motor aspect of cranial nerve 5, which is the masseter. So go ahead and clench your jaw, and the temporalis muscle. Perfect. We're going to also go ahead and feel the temporomandibular joint, so open and close your jaw for me. Perfect. That looks good. So then we're also going to go ahead and just go on down the arms, and I'm going to feel your brachial pulse, your radial pulse, less than 3 cap refill. Your skin trigger is good. You got good skin tone, nice and warm. No lesions, no abnormalities, no edema, no moisture is noted. So now we're going to go ahead and check the symmetry of your face. If you could just wrinkle your forehead, puff out your cheeks. Perfect. So your symmetry is good. That's cranial nerve 7. So now we're going to go ahead and just go to your eyes. So we're inspecting your eyebrows, your eyelashes, your lower lids, your upper lids. We're looking at your sclera, looking at your irises, making sure everything's symmetrical, no drainage or anything is noted. So now I'm going to go ahead and test 3, 4, and 6 cranial nerves, which is the 6 cardinal points. So go ahead and just follow this out for me. And then now we're going to go ahead and we would do a Snellen chart. I don't have one on hand, and that is cranial nerve 2, or we can do this test. Cover the same.
2, 1, 2, 2, 3, 1.
Perfect. So I'm going to go ahead and just look at your eyes here. So we'll look at the red reflex test first. Perfect. So I'm going to go ahead and go in and look at your eye. So your optic disc is sharp. So your optic disc is sharp, no retinopathic changes. I don't notice any hemorrhages. You've got good convergence. I don't notice any abnormalities looking at your eye. So now we just want to double check your pupils, make sure they react to light. They look good. So pupils are even, equal, and reactive to light. So now we're going to go ahead and go to your ears. So we're going to inspect them again, looking at the tragus, looking at your auricle, making sure there's no drainage, no breakdowns or anything like that noted, making sure they're symmetrical, positioned appropriately with the rest of your face. So I'm going to go ahead and just test your hearing, which is cranial nerve 8. So I'm going to do the whisper test. So just tell me what I whisper.
Baseball.
Perfect.
Basketball.
Okay. So now we'll go ahead and do the Weber and Renee test. The Weber test. Here at equal on both sides.
Yes.
Okay. So we'll go ahead and do the Renee test. So we're putting that on the bone there. Tell me when it stops to vibrate.
Stop.
Do you still hear it?
Yep.
Okay. So both of those tests were normal. So we'll go ahead and look inside your ears. The cone of lights at 5 o'clock. Your tympanic membrane is pearly gray. Your auditory canal is nice and pink. I can see your malleus, and I really don't notice any like excessive earwax or shrunken in your ear or anything like that. Alright, the cone of lights at 7 o'clock. Your tympanic membrane is pearly gray. I do notice a little bit of cerumen in this ear. Your auditory canal is pink. And that looks good. So we're gonna go ahead and just look at your nose, testing for any lesions, looking for symmetry. Gonna go ahead and just look up your nose. Alright, turbinates are patent. No drainage, nice and pink. No abnormalities noted. I don't see any like deviated septum or anything like that. And we'll go ahead and just look inside your mouth. So looking in your mouth, we're looking at your teeth, your buccal, your gums, making sure everything's nice and pink. So go ahead and say ah. Alright, so that's cranial nerve 9, just testing your uvula that it reacts appropriately with a soft and hard palate and that it's nice and midline. So test your gag reflex, and that's cranial nerve 10. And then 12 is when you go ahead and stick your tongue out for me. Nice and symmetrical, midline, looks good. That's cranial nerve 12. Alright, so now to round out the cranial nerves, we'll just do cranial nerve 11, which is the range of motion and the strength of your neck. So go ahead and go this side to side with each neck, ear to shoulder, chin to chest, back, and then just press when I resist. Great. Perfect. Great. So that looks good. So now we will go ahead and I'll feel for your carotids. While I'm doing that, I'll just check your trachea. Transmembrane. We'll check your thyroid. Okay. And my stethoscope's different. I don't have a bell or a diaphragm, so whenever I'm like listening to the heart, I would do belly and diaphragm. It's more of a pressure thing, and the same's gonna go when I'm listening to her carotids. So go ahead and hold your breath. Alright, you can take a breath. Hold your breath again. Okay, no bruise or thrills or palpated. So we're just gonna go ahead and go to the lymph nodes. So I'm gonna feel for the occipital lymph nodes, the posterior cervical lymph nodes, the superficial cervical, and then I would ask them to turn their neck and palpate for the deep cervical. Also gonna feel for the submental, the tonsillar, and the submandibular. And then the preauricular and postauricular. And then the supraclavicular and the infraclavicular. I'm gonna go ahead and just do your axilla while we're here. Okay. And then the epitrochleal. Alright, so we're done with the lymph nodes and everything feels fine. So now while you're sitting, I'm just gonna go ahead and start listening and looking at your back. So once again, when we're looking at the back, we're looking for symmetry, making sure we don't notice any abnormalities. Go ahead and just take a deep breath in. Okay, just get appropriate expansion. On back here, I'll do CBA tenderness. And her breathing looks regular. I don't really notice any like uneven expansion or anything like that. So we would palpate for any masses, any tenderness. So I'm gonna go ahead and do tactile fremitus. So just say 99.
99, 99, 99.
Perfect. Okay. So we can go ahead and just listen. So when we listen, we're gonna do all 8 places. On your back. Your breath in. I'm also going to have you, I'm going to listen again, but will you just say E?
E, 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 E.
Alright, and then one more time, but say 99.
99, 99, 99, 99, 99, 99, 99, 99.
So that was just testing for the vibrations. And that all looks good. Well, while we're back here, I would examine her spinal process as well. Not. Go ahead and look at that here. And do that again when they bend over and touch their toes. So since while they're sitting up, I'm going to go ahead and listen to the aortic and pulmonic areas. So just going to have you lean over a little bit. So the aortic area of the heart is the second intercostal space on that right sternal border, and then the pulmonic is on the left sternal border, still the second intercostal space. And while we're here, we're gonna examine the pericardium. So we would check the sternum for any heaves. And then we want to find the apical pulse. Which is mid-clavicular line, fifth intercostal space. So we'd feel for an apical pulse, make sure no bruise. Our apical pulse is about 75. And like I said, the apical pulse was that mid-clavicular line, fifth intercostal space. So I think we're done with you sitting up. I think that you can lay back.
Okay.
Alright, so now while you're laying, I'll stay on this side so it's easier to see. I would listen to your heart. So like I said, we would do the aortic area, which is the second intercostal space, right sternal border, the pulmonic, which is the second intercostal space, left sternal border. Next is Erb's point, which is the third intercostal space, left sternal border. Then the tricuspid, which is the fourth intercostal space, left sternal border. And then finally the mitral, which is the fifth intercostal space, left sternal border. And like I said with my stethoscope, I would do the diaphragm and bell, but mine's a little bit different. Just gonna go ahead and listen to all those areas. Aortic, pulmonic, Erb's, tricuspid, mitral. Alright. So now we're going to move on to your abdomen. We'll listen to your front when you sit back up and listen to the front of your lungs. But we'll go ahead and just go on your belly since I already have you laying down. So we would always inspect before you palpate. So put your pants down just a little bit. It's your whole belly. You're fine. So it looks symmetrical, looks nice and even on both sides. So we would do our percussion. Percussion all four quadrants. And we're going to listen in all four quadrants. I'm just going to listen until I hear a vowel sound. You can listen to up to 5 minutes. I'm also going to listen to the aorta. No brills, no through, no brills or thrill, no bruise. Listen to the renal arteries. Arteries, the iliac. And the femorals. Let's get jeans on. I'm not going to make you take your jeans off. Alright. So then we would percuss the liver, trying to figure out the size of the liver. So we'll say that the liver is probably about 10 centimeters. We can percuss for that. And we're going to percuss for the spleen, palpate for the spleen. You should be able to feel kidney. We would do light palpation in all four quadrants. And then deep palpation. I don't notice any hernias or anything on her belly. Everything looks good. Nice and normal. We have normal findings. Everything looks good there. So now we'll just go ahead and go to your range of motion while you're laying. So we'll do your knees first. So if you can just bend your knee up. Yep. And do that on both sides. Okay. And then if you can abduct and adduct your legs. Yep. And then go across. And then go underneath as well. Like if you could go underneath your legs. Yep, perfect. And then go ahead and lift your leg up. Like just straight up. Perfect. Same with the other leg. Okay. And then if you could roll on your belly. Sorry. Okay. Be careful. Alright, just lift your leg straight up. Yep, and then the other way. Perfect. Okay. Alright, you can roll back over, and then while you're laying here, we're just gonna test your Babinski on your feet. Or take your socks off, sorry. That's okay. Okay. Perfect. Alright, and then I think that's good. I think you can sit up. When you sit back up, I'm gonna go ahead and listen to the front of your lungs, and then I need to percuss your back and your front as well.
Okay.
Forgot to do that. We'll just go ahead and percuss your back. Great. Okay. I'm gonna percuss your front. Alright, and when we listen to your front, we're gonna again listen to all 8 places. Okay, good. Deep breath in for me. One more. Perfect. Then we're going to do the tactile just in the front as well. So say 99.
99. 99.
Okay, great. Alright, so now I would just inspect your legs. We've got jeans on, so we'll just slightly pull them up, see what we can see. And then again, maybe if you be in a gown. But looking again for appropriate sensation, appropriate color, no moisture, no edema noted. Examining your toes, looking for your cap refill, and everything looks good. So now we're just go ahead and do your pulses while we're down here. So popliteal pulse. Posterior tibial pulse. And then your dorsalis pedis pulse. So now we're just going to go ahead and test the range of motion and your strength of your feet. So if you can push up while I push down, yeah, and then go other way, perfect. Now go inwards and outwards with your ankles, yep, and extend and flex, perfect. Can you go inwards with your ankles? Great, and move them all around. Same with your toes, go up, okay. Can you go up and down with your toes, perfect. And then we'll go ahead and do your shoulders. So if you could lift your shoulders up, okay, cross them across your chest, and then go behind your back. Great. And then with your elbows, go like this, and then go down. So again, we'll test the strength. So if you just go this and go, pull against me. Great. And then push. Great. And then squeeze my hands. Okay, good. Okay, so we did all your pulses. We're going to do your arms. So we'll go ahead and just go to your reflexes. So we'll start with your tricep. Your bicep. Okay, and then your brachioradialis. Okay. Patellar. And then your Achilles. Okay. Alright, so now let's try a range of motion. So now we'll go ahead and if you'll just touch your nose to my finger, just testing your cerebellum. Yep. Okay. And then I'm going to put some objects in your hands. If you could just tell me what these objects are. Oh, you're going to close your eyes.
Oh.
You're not supposed to see. There you go.
A quarter.
Perfect. You need to keep your eyes closed.
Key.
Great. I should have told you that. My bad. Alright, so we did that. So now what we'll go ahead and do is we'll test your sensation. So I've got a Q-tip and like the one end, like this would be the sharp, and then this would be dull, and then cotton would be soft.
Okay.
So we'll do your ophthalmic, your maxillary, and your mandible. So now this is testing the sensation of cranial nerve 5. So go ahead and close your eyes.
Sharp, sharp, sharp,
Perfect.
sharp, 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 soft, soft,
It sounds odd, but
sharp,
yeah.
sharp, soft, sharp.
Okay. All right. All right. So now what I'm gonna have you do is I'll have you stand up, and I would have you walk across the room, and I would examine your gait, which is good. Okay. Go ahead and come back. Yep. And then if you can stand with your feet together, you can close your eyes with Romberg chest and checks for swaying. Okay, that looks good. So now, like while you're standing, I do want to just check your hips and your back. So if you could get side like bend, yeah, side and then back, yeah, and then if you could turn as well. Great. So if you could just touch your toes for me, so I can just examine your spine and your hips. And so they're in line. Okay, that looks good. All right, and go ahead and sit back down. And if you could just take your foot to your shin for me. Great. Just testing your coordination. I just want to kind of get back and make sure that I didn't forget anything. Gel your cranial nerves. So I think we're good. All right.
Thank you.
Welcome.
All right.